We also see folks misdiagnosed with things like anxiety or depression. Some of that can be, I think, a very gendered experience. I think there is, medical gaslighting is real, and people don't always have the symptoms that they do experience taken seriously. And so I think from the PH community's perspective, when we see unexplained breathlessness, warrants further investigation.
Welcome to the Expand podcast, where we unlock the secrets of respiratory health for healthcare professionals. Join leading experts as we dive into chronic lung diseases and expand your practice.
Welcome to this new series of podcast on the topic of pulmonary arterial hypertension. This is a rare disease, and I can see already that some people will just say, "Oh, this is not for me." It may be for you, and you don't know. This is a disease where often it is undiagnosed or it is delayed. Patient may present it having unrecognized no cause for breathlessness, fatigue, and they may see their physician. Then this first podcast of a series of 3 will be with Jamie Myrah, who is the Executive Director of the Pulmonary Hypertension Association of Canada. PHA Canada. She's going to tell us about this disease that more for the public and also the patient. This is an organization that is doing a lot in Canada for pulmonary hypertension and pulmonary arterial hypertension. And how can you learn as a patient, but also as a healthcare professional, physician, nurses, educator? You get some information of what can you do for your patient to provide a better diagnosis and leading into a better management as well as in research. Jamie Myrah is the Executive Director of PHA Canada. She played a role since January 2016. As an Executive Director, she oversees all the operation, including program delivery, also governance, strategic planning, public and government relationship. She also had worked on fundraising development. Her leadership focused on improving the life of those affected by pulmonary hypertension across Canada. Under her guidance, PHA Canada has celebrated significant milestones, such as its 10th anniversary. She continued to advocate tirelessly for equitable access to care and support for individuals living with pulmonary hypertension. I would like to welcome Jamie Myrah for this first podcast. Jamie. Hi, Jamie.
Hello, Jean. Nice to see you.
Before we get into the topic of pulmonary hypertension, tell us a little bit about your background.
Yes, of course. Well, I started working in community-based healthcare over 25 years ago when I got involved in the HIV movement in my youth. I think for me, HIV represented the pandemic of my generation. I cared about it because I cared about the ways in which it was driven, the human rights issues that drove the HIV epidemic in the 90s. And I came to HIV at a very interesting time when combination therapy was dramatically changing what it looked like, what an HIV diagnosis looked like and what it meant to live with HIV. And so I worked for 15 years in an HIV movement where we made huge strides in gaining accessibility to treatment, in seeing people live longer, healthier lives. And it really showed me what was possible. It was possible because of community involvement, because of social movements, because of legal changes to the system that could protect people and could help people. And it launched me into a career in community-based health that took me next to the cancer world. I worked for the Canadian Cancer Society for many years and worked in chronic disease prevention, where I was working with community leaders to build healthier, resilient communities. And then eventually I went to law school. I thought, here was an opportunity to take these experiences and continue to look upstream to the systemic, changes and that were going to help make us all healthier and make our communities, stronger. In the end, working as a lawyer was not really for me, but I learned a lot in law school, and I feel I use those skills every day. When I came back to my work in the community-based health sector, I landed in rare diseases, and it took me back to those early days in HIV where, there was this opportunity to dramatically change the course of people's lives. And so I started working in ultra rare diseases. And then in 2016, I was recruited to come to the Pulmonary Hypertension Association of Canada. And I've seen similar things that excite me about the work that we do here. This opportunity to really to see new science and innovation that is changing the way we treat folks and care for them, giving people an opportunity to live with this disease as opposed to, you know, a really difficult journey of diagnosis and difficult treatments and not great outcomes. So it's an exciting
That's
place to be
yeah.
where I feel like we're making real changes.
This is quite of an important and interesting foundation for the PHA of Canada. Well, all the experience and the success on other disease such as HIV. Um, Tell us a little bit more now if we want to enter in the topic of pulmonary hypertension or pulmonary arterial hypertension. What is it?
Well, honestly, I had also never heard of pulmonary hypertension before I was introduced to PHA Canada. But simply speaking, pulmonary hypertension is simply high blood pressure in the arteries of the lungs. But our body has two different types of high blood pressure. There's that systemic high blood pressure that you can get, in your circulatory system going throughout your whole body. I think that's, where you take a high blood pressure medication and it's, you manage it with that and lifestyle changes. But this is different. This is high blood pressure occurring specifically within the arteries of the lungs that's working with your heart to circulate oxygen throughout your body.
Okay.
And so there are lots of different types of pulmonary hypertension, 5 different categories with different causes and different treatments. Pulmonary arterial hypertension is the rarest form of pulmonary
Okay.
hypertension. And it occurs in Canada, we have, only probably 2,000, 2,500 people diagnosed with
Wow.
PAH, perhaps many as 4,000 living with the condition, but, those not
They
yet
don't
diagnosed.
necessarily know about it.
Yeah,
They
that
don't
that really are
necessarily
not
know about
yet
it. Yeah.
diagnosed. Correct, yeah, and so, it's a relatively small number of people. PH is not necessarily rare, it's uncommon, but it's not
Okay.
rare, so PH of all types is going to exist out in the community, but PAH is really very rare and only occurs in a small proportion of people, but can occur in folks of any sex, any kind of background,
Okay.
any age. It can affect people across the lifespan, though it does disproportionately affect women and, in particular, women, in their childbearing years or early middle age.
Okay. Then I think the example you're giving as a parallel that people know about hypertension, and they
Mhm.
know also it's quite common. People know that, there are medication for that, but pulmonary hypertension is really not known very well. And as you said, there are secondary pulmonary hypertension, and that very often will be found because you make a diagnosis of another disease
It could be.
where
Yeah.
the cause of pulmonary arterial hypertension, although it's not as common, this one is much more tricky because it's often said that it is an invisible illness. Then people don't necessarily feel it. It's very hard to diagnose, isn't it?
It is difficult to diagnose. There are many steps in the diagnostic process currently with the technology that we have. There are screening tools that can, indicate the potential presence of pH, and some that can even estimate an echocardiogram, for instance,
Okay.
can even potentially estimate the pulmonary artery pressures. But definitive diagnosis of pulmonary arterial hypertension requires right heart catheterization,
Okay.
a very complex invasive procedure, and eliminating other types of potential pulmonary hypertension can involve other testing as well. So, there's just a lot of testing involved in the definitive diagnosis of pulmonary arterial hypertension, but it's really critical for ensuring that we understand the cause, the type and cause of that pH as best as we can so that it's treated appropriately.
Then what we often see for people to understand is that patient can present with symptoms that are not necessarily specific, such as
Exactly.
being breathlessness. And the most common cause of breathlessness is obviously not pulmonary, arterial hypertension, but they can also be found through an investigation for something else. And these patients could end up to have an echocardiogram, for example, and being found to have something abnormal, such as a pulmonary hypertension, and not necessarily having a cause. Then there could be different way by which the patient could land into either in respirology or in cardiology to be investigated. Then there is a lot of misdiagnosed, okay, while you that in that journey, it may take quite a long time, okay. And how long usually does it take on average for a patient? Because there is often a misdiagnosis for years, but how long usually does it take, okay, for the patient, okay, to be found with the diagnosis of pulmonary arterial hypertension?
So PHA Canada's data from our own community burden of illness surveys indicates that, for about half of patients, it can take 2 years or more to be
Okay.
accurately diagnosed. So there is a significant proportion of patients who are diagnosed within a year, but for many patients, it can be 2 years or longer, sometimes outliers of 3, 4 years. So, we do see what we consider to be delays to timely diagnosis, occurring regularly. We also see that it's quite common for people with pulmonary arterial hypertension to be diagnosed quite late into their disease. So there's not just a delay once people actually start investigating symptoms,
Yeah.
but there's even a delay to patients, reporting those symptoms or having those symptoms investigated. As you've indicated, some of these symptoms are very nonspecific: breathlessness, tiredness,
Yes.
um, you know, especially as we age. Who doesn't experience some of these things? It's very common for people to attribute these things to deconditioning, a lack of sleep, stress of life, and just to disregard even their own symptoms and the changes that they're experiencing. I frequently talk to patients who tell me that once they've been diagnosed, they can remember, experiencing mild symptoms, quite far back, right? Now, whether or not that was pulmonary arterial hypertension or some predisposition, I'm not a medical professional. That's not for me to say, but it's very common for people to have that perspective. And so we do frequently see people misdiagnosed, most commonly probably with asthma. Again, it's probably the most common and reasonable explanation for breathlessness. So why not try and
Yeah.
treat it? But other lung conditions as well, especially as you get into more complex cases where there might be comorbidities present. You have people who might be diagnosed with something like COPD or other
COPD,
type of lung.
interstitial lung disease,
Yeah,
like
and those things might
and
be
so on. Yeah,
present
yeah,
as
yeah, yeah,
well,
yeah,
right?
yeah,
It's
yeah,
not
yeah,
to say that
yeah,
those
yeah.
things can't be present as well, but they may also just be misdiagnosed as those things. We also see folks misdiagnosed with things like anxiety or depression. Some of that can be, I think, a very gendered experience. I think there is, medical gaslighting is real, and people don't always have the symptoms that they do experience taken seriously. And so I think from the PH community's perspective, when we see unexplained breathlessness, warrants further investigation and appropriate testing and a consideration
Yeah.
of the possibility of something rare like pulmonary arterial.
That's a very important point that you're making, Jimmy, and it's about the anxiety. The consequence of misdiagnosis or delaying the diagnosis can bring a lot of anxiety, I'm sure, and even financial consequence. Well, people may just be considered to not having a real condition, and because they're out of breath or they're fatigued at work or even at home, this may have a lot of emotional consequences. Would you say that you have these patients, and I don't know if you have example of patient that you've seen where for a very long time, these people were not recognized as having a condition like this rare condition, and just said, you're too emotional, you're reacting too much, or it must be your anxiety.
Go lose some weight. I think those, all of those I think are common experiences. And I can think of a particular patient who, again, discredited their own experience first, right? They were the first one to discredit that experience,
Yeah.
to rationalize away their inability to keep up with their friends, their need to hang back and pretend that they're tying their shoe or looking at the view because they can't make it up that slight incline that other peers have no problem going up. Staying away from friends or not going out with family because again, you can't keep up. it makes you too tired, you can't recuperate, maybe you have a job or responsibilities that you need to take care of in life, and so you learn to sort of manage this fatigue by not participating in life. So I
Yeah.
think all of those things are common pre-diagnosis, and then you go through that further experience of your symptoms minimized by a primary care practitioner, or being referred maybe to somebody, but then being given puffers and those puffers don't work. And then, you feel like you're not really being helped, or you're a burden to the system because nobody really thinks there's anything serious wrong with you, even though you increasingly can't function day to day. And so, yeah, I think there's a lot of relief in receiving an
The
accurate
diagnosis and
diagnosis,
right, that's
you
I
know,
have something wrong. Okay,
yeah, and,
this is
it's
important. Yeah.
named, it's some, it's an actual thing, tangible thing
Yeah.
that you can learn about and understand. And thankfully, in the case of pulmonary arterial hypertension, there are, a lot of treatment options available.
I think it's important for people to realize that in our society where anxiety and this condition being breathlessness can also cause anxiety and almost kind of a vicious circle. But what you're
Mhm.
saying, Jamie, is very, very important, that any diagnosis should have a test that confirm what you have. If you're receiving puffer, then you should have a test that had demonstrated that you had asthma or you had COPD. If someone
Mhm.
is telling you that you have pulmonary interstitial lung disease, and you should have a chest X-ray or a CT scan. If you have breathlessness and there is no explanation why you have breathlessness, and especially if that has changed over time, you shouldn't consider that this is only related to age or putting weight, but there may be more than that, and that require an investigation by your physician. And if you have a doubt, you could ask your physician to refer you to a respirologist. That would be where the investigation can really be more complete and will lead you most of the time to a specialized clinic in cardiology, respirology, or often multidisciplinary clinic. And when the diagnosis is made, and that leads us to talk about the gap in the system, then the system level gaps. What would you say is the biggest system level gaps in Canada that make things even harder for patients that have pulmonary arterial hypertension?
I mean, I think there are many, but I think one of the most significant ones is just that access to good primary care to begin with. If folks don't have access to good primary care, then and they're not regularly managing changes to their health.
Yeah,
And so, not that we necessarily even expect primary care physicians to all understand PAH. It's a rare condition. Most of them will never see it. But that process that you just spoke to, that ability to refer on to a specialist who can, again, get the proper investigations going. If somebody doesn't have access to primary care, then how is that going to happen? It may be that that's not going to happen until they're seen in an emergency room, which we see frequently. People are often their first interaction with the healthcare system to deal with their PAH symptoms pre-diagnosis is actually in an emergency room and not in a doctor's office. And so I think that just that access to primary care and primary care being able to recognize and understand when to refer on and how to refer on is probably one of the first and most important gaps. And then beyond that, even if you can get to that appropriate specialist quickly, again, there's going to be waits for that specialist. There's going to be the wait times for all those tests. You're going to start with the asthma and the PFTs and the things that, the pulmonary function tests that are maybe easier and more accessible. But in the case of pulmonary arterial hypertension, you're going to need to proceed to probably bigger tests. And in particular, an echocardiogram is what we would like to see folks with potential PAH be screened with. And in some places, that's going to mean a long, long wait for an appropriate echocardiogram. So,
then
and then
advocacy is quite important. It seems to be important for the patient point of view. Seems to be important for healthcare professional, physician, including family physician, internist, respirologist. Also important at an higher level, I presume. Okay, then do you work with different group, society, professional society, but also you work as an association, okay, to advocate for this rare disease? Can you tell us a little bit more about this? how important this is to advocate for this disease at a different level.
Yeah, PHA Canada is always advocating on behalf of patients, PAH patients, and all pulmonary hypertension patients. And, sometimes that means advocating to specific decision makers about specific policies or specific decisions that are being made. And sometimes it's about raising awareness of the perspectives and the needs of folks like pulmonary
Like,
hypertension
yeah.
patients, chronic disease patients, rare disease patients, folks who, rely on innovative medicines to live productive, healthy lives. So we advocate, like you say, across the spectrum of stakeholders. So sometimes that means working with other nonprofits and associations, so professional associations like the Canadian Thoracic Society or the Canadian Cardiovascular Society, or groups like, your like
Respiplus.
Respiplus are, joint partners in the respiratory space where we're working together. We've done work together on COVID-19 vaccination and the importance of health promoting policies for folks with lung disease. So I think that's one example where we've worked with other stakeholders in the nonprofit space collectively to advance the needs of patients. But then very specifically, we're always working with the governments, the federal, provincial, and territorial governments on health policy issues like the rare disease drug strategy or pharmacare or the patented medicines pricing review board, issues related to pricing, to drug pricing or drug availability or access to innovation and clinical trials in Canada. And then very often we're specifically looking for, very specific needs for patients. So access to particular therapies that may or may not be available in particular jurisdictions, or increasing just the capacity of care that is available within
Okay.
within healthcare systems. So we know that the more we diagnose patients and the longer they live, the greater need there will be in the system to care for them.
Absolutely.
And so
Absolutely.
we're so fortunate to have a network of clinics in Canada that specialize in PH care and who in particular follow and manage PAH patients because of the needs associated with their treatments. But those clinics have needs in order to ensure that that we're keeping up with the demand that exists for PAH patients. And so all of those things are issues that PHA Canada works with patients and with healthcare providers and with our partners to address.
That's an important point. Let's start with the clinic again. Then I'd like to come back to the patient in terms of advocacy and how you can help, because I know you're very active. Your association is so important for this rare disease, but having those specialized clinic across the country is very important for a rare disease, because even in the clinic of the respirologist, as well educated respirologists are in the country and the different provinces, this is a very specialized disease, and you'd like things to be working in multidisciplinarity. You need different resources from a diagnostic point of view, but also following these patients in terms of their treatment. And this is a field that is really evolving, sometimes quite rapidly, and following these patients. And these clinics are quite important. What is your role and the relationship you have with the Canadian Thoracic Society, with some of these specialized clinics?
So PHA Canada works very closely with all of the PH centers across the entire country. So the physicians and the specialty nurses and the research
Okay.
coordinators, the folks working in those clinics across disciplines are also volunteers at PHA Canada working on our medical committees, supporting our medical education activities, as well as our education and awareness activities with patients and the public. So we work very closely with all those clinics, and part of the value of patients being cared for in a specialty center like that
Yeah.
is that connection back to the patient association, is a direct line between the patients and the care that they get provided in the healthcare system to us, and the care that is provided for at the community level for education on disease, on treatment, on managing day-to-day living, on support for caregivers, peer support programs for patients and their families, and then giving them the tools that they need to, again, raise that awareness of their needs and directly advocate for decisions that are going to improve their lives. So those are all tools that are provided directly by PHA Canada, and one of the ways that we put them in the hands of patients is by partnering directly with their care providers at the centers.
Think about it for people that are listening.
Hmm.
Now there is a learning experience. All these clinic and people are working with and okay, also providing support and then resources to PHA Canada, and that build over time where okay everyone can benefit from that, and at the end the patient benefit from that. And the most important advocacy for you is the patient. Do you have example of patient that this has really changed their life? Just okay, tell me a little bit more about the patient and your association, because that's the most important part. At the end, it's the patient.
I mean, PHA Canada provides a home for you as a PH
Okay.
patient. It provides a community and an opportunity to ensure that you don't have to face this journey alone. I think of somebody who diagnosed as a young mom at the early height of their career. You know, you're at that point in your life where the things you've been working for in your 20s are starting to happen for you. You've got a family, you've got a
Mm,
career that you're proud of, you're living your life that you've worked so hard to set up for yourself. And then you're struck with this devastating diagnosis and you're given maybe 5 years to live, maybe 7. Your children are 2, 4 years old.
oh
I have
wow.
a 6-year old and I can't even imagine what that feels like, with the with the emotional journey that you have to go through to accept a diagnosis like that. So you get involved in the community because you're looking for some answers to the questions you have, and you find support and friends, and you make connections that create friendships that will last a lifetime. And then new treatments become available, and you know you're going to need those treatments, and your friends are going to need those treatments. So you become an advocate, something you never thought you'd ever have to do, and those skills that you had from your teaching job, which you had to give up upon diagnosis, are suddenly now being tested in this new way. I've said to people, if you can handle teaching a classroom of kids, like you can handle telling your story to, a government official or a doctor or a scientist. Like, they're no more scarier than a classroom of kids, right? So I've seen people really come into their own as advocates, people who have stepped into leadership roles that I don't think they ever thought they were capable of, and have, as a result, really helped to move the needle on access to PAH
Mhm.
therapy in Canada. Several years ago, we had a new batch of therapies come to market in PAH, and a couple of them were not new to the scene, but one in particular was an innovation in a class of therapies where they had only been available through IV or subcutaneous infusion. You're talking about patients wearing a pump and a
Yeah.
line 24/7, receiving medication continuously, huge risks for line infections, pain associated with drug administration, just huge burdens associated with this treatment, but it's life-saving. And so this patient that I'm thinking
Yeah.
about with this family was at the point where, like, this is all that was left, was these therapies. And they, along with other patients, really helped us to advocate for this new formulation of this therapy that was in an oral form, which would allow patients potentially to delay the need to go on these, more burdensome IV and subcutaneous therapies. And this patient was part of leading that effort across the country. And as a result of the campaign and the patients who went out and expressed the urgent need for public access to a therapy like this and the impact that it was going to have on their lives. Like, this was in many
Mm,
ways a quality of life issue, really made a difference. And I confidently believe that it was the work of those patient advocates like this advocate that I'm thinking of, but others like her, that ensured that we got access to that therapy equitably across the whole country and
yeah.
as quickly as we did. It didn't feel quick, I don't think, for the patients. I think they felt like a long haul for them. But when I think about it, when I zoom out and I look at the healthcare system and the regulatory system involved in bringing new therapies to patients, and I see how long it can take, I think, the patients really made a difference in making sure that, that decision didn't drag on even longer. And so being able to ensure that the whole country had equitable access to a new innovation like that took coordination from PHA Canada, but most importantly, it took the stories and the voices of the community of patients and their families that were going to be affected by that decision.
That's quite important because the voice of the patient can make the whole difference through the example you're just been giving. I think people have to realize that when we're talking of pulmonary arterial hypertension, we're talking of a disease that can affect the people in the young age, man and woman. Okay, slightly more woman, okay, than man. That this can be very often we hear about the diagnosis of cancer, and immediately people are thinking about what is my 3 year, my 5 year survival. When you have a disease such as PAH, and it's important for the patient, okay, to have a perspective, okay, of what is this disease? What are the possibilities that I have? How can I go through relatively normal life as a mom or as a dad or as a someone, okay, that is already working? And your association can be a place for the patient at the beginning and during the whole trajectory of the disease. But at the beginning, where you need the most of that information, and you may not have all that information in one visit with your doctor. Some of these clinics I know are very well organized, okay, and then they're going to provide the support of it with a case manager. But still, your association is very important, and that's a place where people can knock and should knock at the door first to receive your service, and later on, as your example you've been giving, Jamie, to be part of that association and bring advocacy in your association. Okay, that what if I would try, okay, to look at what would you like to say that next priority would be in for that disease, and what you would like to people to hear, okay, from that, what do we need mostly in that would help your organization and will help, okay, those clinic and will help the patient?
Well, my wish list is a little long, I have to admit, but that's my job, right?
Absolutely.
Yeah. We are at the beginning of a new era in
Okay.
the treatment of pulmonary arterial hypertension. The new treatments that are coming to market now are going to radically shift the way we treat and manage pulmonary arterial hypertension.
Okay.
And we have a responsibility to ensure that we educate our health systems and our health system decision makers on those new realities and the impacts that it has on patients and what matters most to patients so that we can all work together to effectively plan for what's coming. Because PAH patients are going to live longer. And the better diagnosed they are, the better managed they will be and the longer they will live. And so we did it with HIV. I'm going to go back to the beginning of my
Absolutely. That's
story.
a good example.
We've done it in other areas and we can do it here too. And this is a really rather small group of people, right? So it's not the tallest order that we've ever had to fill. And I know we have the capacity within our systems and the capability within our community to make this happen. So access to those new therapies and access to the sustainable healthcare system that's going to support those patients long term is the goal. I think one of the ways we're going to get there is through data. I think one of the things we're committed to at PHA Canada is we have a goal of making sure that all of the patients, starting with the PAH patients, but really all the PAH patients, but right now I'm talking about the PAH patients, are in our national PH registry, and that their data, including their patient-reported outcomes about the impact that their disease has on their daily life, but also their outcomes based on their treatment, get tracked so that we have the real world evidence necessary to be able to make some of these complicated decisions about how best to manage people. I mean, one of my big wish items is that we need to get to a point where we have better diagnostic tools. We don't have good simple tests. PAH is not truly a diagnosis of exclusion. It turns into one because there's so many steps that we have to take to ultimately identify PAH. I get that nobody wants to start with a right heart cath, and we would never suggest that. But if we could get to a point where we had better biomarkers to be able to screen and identify PAH, patients or the risk of PAH patients, if we could use data in, echocardiograms and, and other health systems data to be able to identify identify those patients
Identify.
that we can't, that we're not finding otherwise. Yeah, we need better diagnostic tools so that we can really treat people much, much faster. Well, diagnose people so we
No.
can treat people much, much faster. And with the new treatment modalities that are coming, treating people sooner is going to matter even more. And again, it's going to help people live much, much more
Much.
healthy, productive, well lives for much longer.
There's a couple of important points here that you mentioned, Jamie. First of all, the registry. And I think if I had to do a sale for your association, I would do it now. And seeing that all the clinic should be part of that registry. A national registry would be important. Then the different provinces will need to be part of that. Anyone out there who wants to give money to your association, um, your group as an advocacy group will allow, okay, to support, because registry needs some additional work.
We have a great national registry, and we've
Good.
got more than half of our centers are enrolling their patients, which is wonderful. And PHA Canada has been trying to support those clinics to get that data entered and get those patients up to date in those registries. We know that there are barriers and capacity issues to centers doing this work. But for me, it goes beyond just having the patients in the registry. We also have a vision of increasing the kinds of data that are available in that registry.
Yeah.
So that we go beyond just clinical data and patient reported outcome data to biological data such as genetics or tissue and blood samples. Again, giving us more information so that we can find those biomarkers, so that we can figure out which treatments are going to work for which people at which times in their journey. And we can be much more precise in how we treat patients, which is going to bring benefits to the healthcare system as well.
Research, that's the second message through the registry. But also in a rare disease, people don't realize why it's important research. It's not only important for that disease. There is a lot of derivative research where it's going to benefit discovery, would
Mhm.
lead us in understanding other disease, maybe even some of the secondary pulmonary hypertension disease, where we may not have, okay, a treatment for that pulmonary hypertension while we have a treatment for the underlying disease, but we would need a treatment for pulmonary hypertension that are secondary to an underlying disease. Then a lot of this research, even though it may seem like, oh, my research is going to be on the most common and more important disease. No, I think at the government decision maker level, it is important to support rare disease research. This is affecting the population. There is a huge cost to patient life, but a huge cost to the healthcare system also. And the derivative of this research can lead into discovery, not only on that rare disease, but other disease that could make the difference. Okay, we don't know what we don't know.
Absolutely.
That's the beauty of research. That I think this is important for people to understand. The registry has different value, and not only, like you said, just only to have data on patient and thing that we know, but have better data to a better understanding, new research question and new study that will make the difference in the diagnosis and in the treatment of the pulmonary arterial hypertension, and even pulmonary hypertension secondary to other chronic conditions. If you had one thing to say, and for ending these podcasts, we leave people on a positive message here.
Well, we always like to remind patients that they're never alone in their
Mhm.
PH journey. But the same goes for their care providers, whether they be healthcare care providers or family and friend care providers. PHA Canada is here to support the entire PH community, and we have tools and resources available regardless of what your part in it is and at what stage you're at. I have seen people come to us, sometimes people come to us newly diagnosed with a sort of energy.
Yeah.
Sometimes it's driven by, the trauma of that diagnosis for sure. But it's driven by just an intense need to contribute and to something greater than yourself. When people go through something life threatening, life changing, like a diagnosis of PAH, it gives them a lot of perspective. And I've seen people develop a lot of passion for helping others.
for
And
helping other.
yeah, and when you get involved in the patient association, maybe you get involved so that you can help educate your family and friends better or raise some awareness in your community. Then maybe you go on and you start supporting your fellow patients and peer support programs and support groups. But at some point, people sort of work their way up that ladder of empowerment, and they find ways to use their story to really change the course
Mhm.
of the disease for everybody, whether that be through participating in research,
Yeah,
or through making that research, not just, come to life in the form of real life applications, but actually make them accessible in an equitable way so that everybody benefits, not just yourself or the people like you, but, we're reminded in PH all the time that sometimes the folks who have the greatest challenges are the ones who live somewhat outside the healthcare system for whatever reason, who have good reasons to mistrust sometimes the healthcare
exactly.
system, like Indigenous patients might. And so, we have to collectively work together to find ways to make sure that those changes bring benefit to everybody and that we're not leaving anybody behind.
I think what people have to remember, the strongest message that you've been delivering to your association is that a patient with PH has a own. Healthcare professional have their own also, and this is important. And that own people have to feel secure. They can get information from themselves. They can also get information either through these specialized clinic or to your association for research. And at the end of the podcast, people will have the link and the information that if they want to reach to the PHA Canada, that to they can reach to you as well as healthcare professional, educator, physician who need it. I'd really like to thank you, Jamie Myrah, Executive Director of PHA Canada, for giving us the chance, okay, to have the voice of the patient, what your association in Canada is doing, and what you can offer in your own as to the clinical information support, but also what this is the beginning of a new era. And we might be seeing in the year to come what happened with other disease where it seemed that there was very little, okay, to hope in. Now there is a hope, and in a few years from now, we're gonna have even more to offer. But we all need you, okay? And this can be done through your association, the PHA Canada. Thank you very much, Jim.
Thank you. And thank you so much for the opportunity to share about our patients and their lives and bring their voices forward.
Thanks for listening to the Expand podcast. Stay tuned and listen to other episodes on chroniclungdiseases.com/podcast.